Everybody, thanks for joining us. I'm Dr. Jeff Brown, the host of the Merge Medical Podcast. I'm joined by my co-host, Dr. Jeff Cole, and Dr. Esra Roan and Jane Berz of SOMAVAC. SOMAVAC is a late-stage medical device startup. SOMAVAC makes a surgical drain that is a significant improvement over the nearly 100-year-old Jackson Pratt drain, improving patient care, satisfaction, and outcome. With that, guys, tell me about SOMAVAC.
First and foremost, thank you so much, Drs. Cole and Brown, for having us. SOMAVAC Medical is a early stage medtech company that's early revenue stage. We make products that deliver deep tissue negative pressure therapy attached to up to 4 drains of surgeons choosing, 15 and 19 French drains. And we deliver deep tissue negative pressure therapy into the surgical site in a very patient-friendly manner where patients no longer have to interact with their bodily fluids. They can dispose of their fluids with one-click disposable bags and measure the amount of fluid inside of that bag. And ultimately, we have data that shows we reduce time with drains, for example, in mastectomy surgeries from 16 to about 11 days. And the goal is to deliver deep tissue negative pressure therapy, remove fluids in a closed system to then possibly mitigate infection rates and other complications that are associated with accumulation of fluid after large flat forming surgeries in plastic and general surgery.
This product is so important. I've worked with women for decades now that have been post-op from breast cancer surgery, and the drain has become the number one problem in their life and their family as well. The diagnosis of breast cancer gets lost in the shuffle once they're home with drains and having to manage these drains. The drains are not user-friendly, and yet they're so dependent on the user knowing what to do with them to create the pressure that creates the suction to drain the fluid. So for me, as I've taught patients, I've worked with surgeons, I've worked with people at home, there is always, I would say anecdotally 100% problems dealing with drains at home. And so from the psychological standpoint, the clinical standpoint, patients are allowed to be worry-free, wear the SOMAVAC vacuum drainer and a belt around their waist. It's continuously providing suction to remove the fluid and allow the patient to focus on dealing with the cancer diagnosis, dealing with recovery, and preparing for treatment, allowing treatment to occur, which is the life-saving element of cancer treatment, and not being bogged down in the surgery post-op care with complications related to seroma. So it has long been awaited, and it cannot be soon enough.
How about competitors? Is there anyone else making anything similar? And is your technology protected by IP or patents?
To the best of our knowledge, we are the only FDA-cleared powered suction device for seroma prevention. So we do not have direct competitors at this point. Certainly interrupted sutures or adhesives are means to bring tissue layers together and mitigate seromas. We have 3 lanes of patents we filed, not only for the current technology, but we have another patent for what we refer to as a dual indication device that we've envisioned that combines a WundVac with a SOMAVAC, which is a topical negative pressure therapy and a deep tissue negative pressure therapy, 2 devices in one, which we believe will make much sense, especially in orthopedics, with WundVacs being so common in that world. And then the third lane of IP is related to our fluid collection system and the analysis of that fluid. Fluid we're collecting daily in a closed system from the surgical site. There is a lot that can be done within the technology, within the bag itself, and how it's goes through the lab systems per se, in looking at the contents, whether it's proteomics, cytology, physical properties of that fluid. So we have these 3 lanes, and we have protection internationally as well. We pursue that early on.
How about sales channels? Is it the hospital systems, or is it the surgeons themselves? Who ultimately is going to get these devices in use?
Currently, we call on our surgeons, plastic surgeons first. We talk to them about SOMAVAC, and we say, here is a technology. Ultimately, it's the hospitals that are purchasing the devices. It's covered in the DRG, or the overarching pay for the surgery. In breast reconstructions and hernia surgeries, that's what we're doing, and that's where we're really going out. Go-to-market strategy involves those indications that take place in the hospitals. However, once we get in the hands of our plastic surgeons, who also have their surgery centers where they do tummy tucks or other explantations and so on, we immediately found that either they bundle us in the cost of the surgeries or offer us as an option to patients as well. So that happens alongside with the hospital sales.
So tell me a little bit more about the technology.
SOMAVAC is a continuous deep tissue negative pressure therapy. So it delivers negative 100 millimeters of mercury continuously. With bulbs, you initially have that high 100 to 125 when you first squeeze a bulb, but as soon as it gets 25 cc of fluid, it's gone down to 40 millimeters. So it's lost all of that. SOMAVAC is a fully closed system. Fluid comes out of the body, goes into bags with one-way valves, and then we have a one-way valve when we attach to the drain. No backflow. We mitigate backflow as much as possible, which we know that after interviews, our patients do take bulbs off the drains, or bulbs do come off the drains. So by closing outside to inside, we hope to mitigate, have an impact on mitigating infections. The system is very small, about this big, and then the fluid is collected in disposable bags, so the patients can just one click and throw it away. So it makes the operation and the feel of the devices so easy. We hear sometimes our patients are out grocery shopping, or one of them visited our offices with it on. They can go on with their lives, because we hear over and over, I couldn't go do Thanksgiving, I couldn't go do Christmas, I wanted to go. So we allow our patients to go on with their lives, because one of the things they regularly told us is, 10 days out, I was no longer taking pain meds, but I couldn't go anywhere because of the drains. So we help patients. The design is slick. It's about 1.5 inch, 2 inch thick technology. It can be hidden under clothing, but continuous suction and mitigation of backflows. And really, when you deliver continuous suction in surgical site, you have the chance to continuously pull the fluid out. Nothing accumulates. You have the chance to bring tissue layers together, and then your drains can come out earlier.
That's fascinating. I mean, what did you say you would reduce drain time by? 5
days in mastectomies.
That's fantastic.
And if you think about the clinical practice of like a hernia or a breast cancer case, you have your surgery, you come weekly to visits, right? Our goal has always been, can we knock out one clinical visit, right? 1 week out from each indication.
Wow.
How amazing that would be. The goal for the company has been, can we build enough trust with our surgeons, and can we have enough data behind us that we knock out 1 week from each indication?
And I don't have to remind the physicians or the practitioners listening, if they're paid one global payment, that follow-up care is included.
Yes.
So if you were to reduce one visit, that's just more efficient for the practice.
Or imagine if you're having seroma visits, meaning aspiration visits or infection visits, and managing a patient post 4 weeks. One of the things that we hear, the third week, right? you either choose fluid challenges or infections. That's what you'll hear from plastic and general surgeons. They will pull the drains out, knowing that they are possibly choosing between infection or seroma. So they will rather do the aspirations, but not want to have the infection risk. So our goal has always been, let's knock out 1 week, right? And we are seeing, in one of our clinical studies, we've come down from 16 to 11. Anecdotally, we have additional data, which we intend to share in the upcoming, you asked earlier, one of our immediate goals is we've had so many cases, so many anecdotal results. We have to turn those into technical notes, papers. We have to share our successes with our medical community as best as we can in the upcoming months and years.
You're also having patient satisfaction increase, physician satisfaction increase, payer satisfaction increase. It's really all across the board, enhancing healthcare, patient care.
While it's so obvious, the question is, why has no one done this before? And is this, why does this matter? And so on and so on. So that's why I really ran after this problem, because I felt like putting the care in healthcare, looking at this problem really from a different angle, from all of its angles, was really important to solve this problem with drains. Once drain management went home, I think it became this blind spot, right, for everyone. So the company cleared the FDA, and right as we were launching our technology, COVID hit, and a variety of things snowballed. And right now, we've had over 500 units, closer to 700, I think. I need to double check that, but units shipped. And one clinical study completed. We have new management that I'm very excited about running our company, and Jane Berz joining us. And we have 5,000 square facility. By the way, we haven't even touched that. We make this product. We assemble it in Memphis, Tennessee ourselves.
Nice.
Yes. And that ownership not only makes us more nimble in the sense of cutting costs, reacting to feedback from our customers and so on, and thinking about new products. So with all of that said, we do have an open round, $3 million convertible note round. That's 25% discount and 6% interest. We have about 400,000 more left. So we are looking for investors who might be interested in coming and closing this for us. We really are on the cusp of going out there, commercializing this technology. We have a lot of the pieces together. We de-risk the product market fit. Really, it's the commercialization stage, whether it's with strategic partners or ourselves. That's where we are working on that piece.
That's awesome.
Yeah, that's great. That's great.
So I can summarize that and say, hey, this is something that improves patient compliance. It decreases infection, decreases reoperative occurrence, decreases the drain time, improves patient satisfaction, physician satisfaction. I can't think of anything bad.
Yes, yes. And we, as a company, we are hearing those, we are seeing those. We need to document them and bring them as facts to you. We have some of it happening, and most of our physicians that use it, like I said, I've never taken a patient back to the OR with a SOMAVAC, or as you know, some of this is we have to do better working with hospitals and getting some of the charges to reimbursement data to justify how SOMAVAC fits them as well. And that takes resources. So that's why as a company, we have to walk the walk, right? Limited releases taught us a lot, sophisticated, our product got sophisticated. Our team learned a lot about how to message, how to talk about our technology to hospitals, because it's obvious to patients how we help. I don't have to afford, that's great. Now we're ready, right, to go out there and get this product in the hands of everyone. And our investors, we've raised, we've raised about $6 million in total for the company over the past 6-7 years. So we're excited about what comes next. We're looking for partners, and definitely we're looking out to grab this last bit of $400,000 to close this round. That will be convertible into Series A funding or another kind of strategic partnership event.
Just really, really good stuff. We're going to see some great changes. I'm glad to be a part of it. Glad you are here. Thanks again for joining us.
Yeah.
Let us know how we can support you as well. I mean, we're all in it together in entrepreneurship.
Absolutely. That's the truth, right?
I have these days, I'm running into great companies out there doing amazing work.